the Alberta government is not going to pour any more money into the current healthcare system because they're going to say, why spend more money to make it better when we can just say it is what it is? And if you want something better, you can go get it yourself and pay your own money. There's no incentive to make it better anymore. Hey, everybody, and welcome back. Healthcare, which every Canadian understands. We have problems with our healthcare system, but compared to the US, it's fantastic. Nobody goes broke. If you require it right away, you're taken. You don't have to deal with insurance companies, premiums, deductibles. Think about it. Just what you have to deal with your insurance company when you get into a car accident or someone fender benders, the disaster you have to deal with rental of a vehicle, dealing with the body shop, how much deductible, how fast you're going to get it, to paying for, it's just a disaster. But in Alberta, of course, their Bill 11, they're adding a couple things that I agree with. But the one thing that they want to do is start privatizing surgeries, knee and hip. Okay. And they're going to tell you the benefits of it, but they're lying. They're starting slow. They're using the political capital that they have now because they're supposedly doing well, which I disagree because they've got a campaign going on that voters are going to recall 11 MLAs to do a special election on them, to recall them. So if they were doing that well, there shouldn't be any of these recall issues. But you need to be careful of how they're wording this and how they're trying to sell these changes in Bill 11 that's going to benefit Albertans and make the system better. Privatization does not make the system better. Go to the US, talk to any American, and ask them how their healthcare is. They're fighting to have a single-payer healthcare like Canada and the rest of the world. Yet Alberta wants to go in the opposite direction and goes to an American system. I don't understand. I've never seen a province try so hard to become a 51st state indirectly. So, anyways, let's take a look at their explanation of why they want to do this, and we'll discuss and just absolutely destroy and poke holes in all of their arguments.
The Alberta government is revamping the rules around several parts of the healthcare system, food safety and drug coverage for one, and it's introducing private options for surgeries. The changes are outlined in Bill 11, the Health Statutes Amendment Act, and are meant to modernize the system and reduce wait times. First, the province aims to bolster food safety by creating a specialized public health team to investigate food establishments. When it comes to drug coverage and payment, people with insurance programs will have to use those first, and the government would be the backup if needed. The most controversial part of the legislation paves the way for privatizing some medical procedures, like knee and hip replacements. The province calls it the dual practice model. Doctors can elect to do surgeries in both the public and private spheres. Health Minister Adriana LaGrange says the model doesn't include general family physicians, nor urgent things like cancer treatments and emergency surgeries. And she says they'll have safeguards in place to make sure public money isn't used for private services. The province also hopes the changes will encourage more doctors and patients to stay in Alberta.
When an Albertan currently goes to another jurisdiction and has a surgery done privately, we don't pay for that. But we are responsible for aftercare. And all day long, I would prefer to have surgeons accredited here, approved here, performing surgeries on Albertans here.
But the ministers couldn't say how much it would cost Albertans willing to pay. The Canadian Medical Association says it believes Alberta's private care plan will actually add to wait times. And the Alberta Medical Association says, as far as it knows, the government hasn't done a proper business case or analysis to determine whether it will work. The bill is tabled in the legislature, and if passed, the government says there's a lot more work to do. They will consult the AMA and the College of Physicians and Surgeons and other health services in the coming months. They expect to finalize the details in the spring. Natasha Reeves, CBC News, Edmonton.
Okay, So there's a lot here. Let's first talk about their their reasoning is that some Albertans leave the province for procedures. It's already being done. Okay, probably same thing here in Ontario, Manitoba, Saskatchewan, probably everywhere in Canada. But do they explain why? And do they explain the type of clientele that are doing this? It's not you and me, the average citizen. It's somebody who has a lot of resources, a lot of money, who can fly to another. When they say out of province, they're talking about they're going to the US, because they're not going to Manitoba, Saskatchewan, British Columbia. They're doing it outside of Canada. They may be going to Europe. They're probably going even to Mexico, because there's a lot of procedures in Mexico that are cheap compared to the US. So it has nothing to do with anything but the investment that Alberta is doing to the current healthcare plan or healthcare system that Alberta offers. Okay, the only people that are leaving are the ones who can afford it, rich people, not the average citizen. Now, to allow doctors to make the choice to do private and or public. I don't understand how we have to explain this. Think about it this way. A doctor has a choice to do public, which charges, say, $50 for a procedure, or a private where they can charge whatever they want, because there's going to be a clientele, the rich, who can afford it and willing to pay. So the doctor is going to choose to do the private. Now, I'm assuming with the consultations and everything else that they're going to do up until they finalize everything is they're going to say to the doctors that you can only do, let's say you're doing 100 operations a year. You can only do, let's throw a number out there, 50% of them can only be for private. The other, you can't do all the capability of just private. You have to be able to service the public. Okay, and then they're going to say, see, they're not going to leave just for private. They're going to stay within the public system. But that's still a problem. Even if they do 20%, let's say out of 100 operations for knee and or hip replacement, let's say, again, stick with that number of 100. They're only saying 10% or 20%. That's still 10 or 20 operations that they can do private. That's 10 or 20 that they're not doing for the public. So if they have the capability of doing 100 operations a year, time, stress, and everything else, you've reduced their capability of doing more operations in the public. So therefore, the wait times are not going to get smaller. They're going to get longer because you've restricted the amount they can do on the public sides. Now, their idea is, well, don't worry about the increased wait times because those people will just pay the money and do it on the private side. Again, only the rich, only people who have money are going to be able to afford that. So I can't see how that, but even then, now you're forcing people to pay for an operation if they can, and that's still not right. If you can't wait for this, therefore just go. We've given you options. You can get the operation, you can either wait for the public or you can wait for the private. But the private, you got to spend. Let me tell you, let's even go over the cost of a private surgery. And we're going to use American prices because that's where it's going to be compared to. Okay? So, knee surgery. The average knee surgery in the US is $23,000. In US. You convert that to Canadian, that's $29,900. That's $30,000 for a knee surgery on average. It's not going to be more money because they can go to the US and do it. Maybe they'll do it a few extra bucks less because then you have to do travel, secondary care and everything else. So let's knock $10,000 off, okay? So it enticed people to stay in Alberta to do it and do it. That's 20 grand. $20,000 for a knee surgery. Do you guys have $20,000? Does anybody have $20,000 saved in their account to do a knee surgery on top of everything else in terms of cost of living? Hip surgery, which really relates to a lot of elderly. Okay? The average cost of hip surgery in the U.S. is $23,000 to $74,000 because it's more intricate. It could be very simple or very complicated. That's $29,000 to $96,000 Canadian on average. Again, let's take even again the cheapest one, $29,000. Let's knock $10,000 off. That's 20 grand for hip surgery. How many people who are in the elderly age have $20,000 just laying around? How many? And that's on the low end. It could be more like 50 grand because there's such a huge range on the cost for hip surgery because of how complicated it can be. Where in the beginning, not a lot of people are going to be doing this because they don't have the money. And then some people are going to get desperate because then when they do this and they implement this, the Alberta government is not going to pour any more money into the current healthcare system because they're going to say, why spend more money to make it better when we can just say it is what it is, and if you want something better, you can go get it yourself and pay your own money. There's no incentive to make it better anymore. That's the problem with this two-tiered system. There's no incentive to fix the current system because there's the option to pay more to get what you want. So the current system is not going to be increased. They're not going to put any more money, resources or whatnot. So the wait times not only are going to get longer because the doctors are going to be able to opt into private and reduce the amount that they can do in the public side. So there's less number of surgeries offered on the public side, but they're not going to add any more incentives or resources on the public side to make it better and faster. So it's only going to get worse. That's how you entice people to say, well, you know what? This is why the public side doesn't work, not knowing that they're not increasing or adding anything to it. They've given you the illusion why the public or the private healthcare is better. That people are going to say, well, I want to pay money out of pockets, which again, who has 20? And that's just on these surgeries. Eventually, they're going to offer it on GPs. They're going to offer it on specialty doctors, say like ears, nose, and throats, cancer doctors. Oh, you want to get, cancer. That'll be the next one. You want to wait for the public option where time is of the essence? Or do you want to spend, what do you think it's going to cost for cancer treatments? Tens of thousands, hundreds of thousands of dollars. But people will be willing to pay because it's their life. And this is why the American system sucks. And this is why they don't want to change it. They talk about case study. There is a case study. What's going on in the U.S. just the south of us, we can see how it doesn't work. Because if it did work, the people wouldn't care about a single payer option. And we would already be there because we can see that the healthcare system would be better in the U.S. compared to in Canada. And they know this. They know this. So this is why, like people always talk about Danielle Smith is for the people. She's the one making Alberta great again. Guys, if it was great, why are you doing this? Why not pour more money into the healthcare system so that the wait times go down? Make things more efficient so there's less paperwork, bureaucracy, something, whatever. You can make multiple different changes without having this option for privatization, which again, you're still paying taxes, okay? You're still going to be paying your taxes. Your taxes won't go down, but the services offered to you will be less. And then if you want proper health care, you have to pay out of pockets. Fight against these changes. Fight for better public options. I'm not saying just open the floodgates and give the system whatever it wants in terms of money. Talk to the doctors, talk to the health care professionals. See where things can be more efficient. Better technology, better procedures, better logistics, paperwork, whatever. The only reason doctors are going to come to Alberta is not because of the public option, it's going to be because of the private, and it's not going to help the system. Anyways, I hope this doesn't go through. I hope there's a lot more pushback. You got to tell everybody that live in Alberta that this is not good. Just look in the States. Again, I can't, like beating a dead horse. Just look at the States. Not going to work. And it only is going to work for people who have money. They can afford it. They can afford the deductibles. They can afford the premiums. They can afford anything above and beyond that their insurance company does not cover. The average citizen, no. And that's why bankruptcies will go through the roof. Anyways, that's it for me. Let me know in the comments what you feel about this proposal in Bill 11 in Alberta, and what you think can be done to let the politicians know that this is not good for the people or Alberta as a whole. And if there's any Americans out there that are watching this video, like, share your story. Tell us, Canadians, how this is a stupid idea. Tell us your horror stories of what you've had to deal with the insurance company. Anyways, guys, take care. We'll talk later.